Hello guys, welcome back to another video. So this is a part 3 of the internship series. I've already made two videos about internship. Yeah, so this is just a part 3, and this part 3 we will be focusing on government versus private internship centers. Yeah, so I'm doing this video because I have experienced both sides, the private side and the government side. So the private side, I experienced it before joining my internship because I volunteered in one of the private facilities for like 6 months before I joined internship. And currently I'm doing my internship, almost done, in one of the government facilities in Kenya. So I'm giving my honest opinion because honestly I've experienced both sides to give my opinion. So let's start with some of the things I've already talked about them in the previous videos, but now this video is more detailed. So in the previous video I talked about resources, as in gloves, BP machines, pulse oximeters, and in private facilities you don't have to look for these things because they are readily available. But in government facilities, I'm telling you, you will look for gloves, you will look for them, you will be shouted at or reprimanded for not taking BP measurements for a patient in the ward, not because you are lazy, but because there are no BP machines. So they're like, go to the maternity, go and borrow a BP machine there, but they won't give you. So in private facilities, you don't have to look for anything. Everything is at your disposal, unlike in government facility. Another thing on resources is blood for transfusion. I'm telling you, in a private facility, if a patient needs blood, the blood is available there, and then there is no like waiting for a week or a long time. Unlike in government facility, if you have a patient in the ward and they need blood, there is this discussion of have they donated the blood. If they have not, they can't get the blood. It doesn't matter if the patient is so critically ill. Like in my facility, the only patients that are given first priority are the maternity patients. And if the patient is not a maternity patient, then that patient is going to wait for a very long time before they get blood, especially if the relatives to this patient have not donated the blood. So that we give the private side a 1. Yeah, so the private gets a 1 mark, 1 point, I mean. So another thing is about housing. I talked about it earlier. Most of the private facilities, they give housing to the interns and also the healthcare workers, unlike the government facilities. So if you're in a government facility, you suit yourself where you're going to sleep. You have to rent and pay all other bills that are included in your house. But in my facility, which is a government, there is a core room where the doctors and the interns that are doing the night call, they get to sleep. But the problem is the beds are very, very few. So you might go to sleep on a bed alone, but when you wake up, you're like 4 of you on the bed, and it's very disturbing, honestly, because you'll find that you might be the only girl sleeping on that bed, and there are 3 giants men sleeping with you and you can't do nothing. So that's a downside. So private facility gets another point. So another advantage is not an advantage. Another point is some private facilities, they pay their interns. Like that facility that I volunteered, these interns are getting an additional 15,000, and we are not even counting what the government are giving them. So imagine these interns are getting free housing, they are getting an additional 15K from the hospital. So that's a plus. That's a plus. Where in a government facility, whatever the government is giving you, that's it. Nothing else. You can't get anything else from the hospital that you are doing your internship. So private facility gets a third point. Then another point is employment. Like you have to look after internship, the employment opportunities. And that private facility that I volunteered, after these interns were done with internship, they absorbed almost 70% of their interns. So the likelihood of being employed in that private facility that you have done your internship, it's very high. So 70% were employed there in that facility. Others were given the other 30%. They were given an opportunity in that facility, but they were not comfortable, maybe because they had other connections or they had other plans. So when it comes to employment, those interning in a private facility, they have a higher chance not to tarmac, unlike those in a government facility. So private facility gets another point. Another point is no learning opportunity, as I talked earlier. Those in government facility gets to learn more skills, unlike those interns in a private facility. For instance, in my government facility that I'm doing my internship, we are allowed to do CSs, we are allowed to do suturing, we are allowed to do broken needle technique when withdrawing blood from neonates. Unlike in private facilities, some of the private facilities that I know of within Nairobi County, they don't allow interns to do such procedures, and therefore their interns have to come to the government facilities to learn these procedures. And I've made several friends from those private facilities because they came to where I am to do CSCs and the broken needle technique, MVAs, and other skills. So for the first time, government facility gets a point. Then let's talk about strictness. Yeah, how strict the facility is. Honestly speaking, the private facility that I was volunteering, they were so strict. And remember, it was a Catholic, it's a Catholic, not it was, it is a Catholic facility. Those people are strict. I'm telling you, they are so strict. There, the nurses are powerless, they can't prescribe anything. There is a time to go to work. If you can't enter that gate after 8 a.m. because you can't, yani, you will even be so embarrassed to get in that gate if it's past 8 a.m. Again, leaving, you can't leave before 5 p.m. because where are you going to? It's not 5 p.m. Where are you going to? And yeah, it's tough. It's very strict. Unlike where I am, you can leave even as early as 1 p.m. As long as you are done with whatever you're supposed to do, you can just leave. Because what are you staying there to do? You're not on call. You're not doing a day shift. You're not doing night shift. You can just leave. So honestly speaking, private facilities are very strict. So I give a point to government facility. So yeah. So that's it, guys. From those points, maybe you can add more points to the comment section, and maybe you can decide whether to choose the private facility or the government facility. The decision is yours. Thank you for watching, and subscribe, like, share.